Hi, my name is Carson Vroom, and the genetic disorder I will be talking about today is congenital adrenal hyperplasia, which is also known as CAH. Congenital adrenal hyperplasia is defined as a group of genetic disorders that affect the adrenal glands. The adrenal glands are small glands that sit on top of your kidneys, and they're responsible for producing hormones. They're a huge part of your endocrine system. I think a lot of people, when they think of an endocrine issue, they think of diabetes because it's really common. Some examples of hormones that are produced by the adrenal glands are cortisol, aldosterone, and androgens. Cortisol is a hormone that regulates your body's response to illness and stress. Aldosterone is a mineralocorticoid that regulates sodium and potassium, and an example of an androgen is testosterone, which is a male sex hormone. Before we get started, I kind of wanted to have a visual representation of the adrenal glands, and so you can see in the picture on the right, they sit right on top of your kidneys. Another important part of your endocrine system and with the adrenal glands is metabolism and immune system. So if you don't have, a good endocrine system, your whole body can get kind of haywire. The picture on the left is just kind of an example of the shape and the different chemicals and hormones that come from the structure itself. There are two types of congenital adrenal hyperplasias defined by the Mayo Clinic. The first is classic. The classic is a rare form, and it's usually detected in infancy. It's a little more serious. It can come with a form known as the salt-losing form, and your baby can get pretty sick and deteriorate pretty quick with this form. We'll talk about it later on in the symptoms. Another form is the non-classic, which is milder and a little more common. It can be diagnosed later on in age, early childhood, early adulthood. Symptoms of classic, which is the more rare one. The first symptom is ambiguous genitalia, which in females, that is an enlarged clitoris. Doing a little bit of research, I saw pictures, and they compared the female clitoris to a male penis. They looked really similar when they were infants. Males and females, they have a lack of cortisol, aldosterone, or both, and that can cause an adrenal crisis, which, like I said, can kind of put your body in overdrive and get all haywire. The lack of cortisol can cause problems with regulating your blood pressure, blood sugar, and your energy. All that combined, that's when your baby can get pretty sick. They can deteriorate pretty fast from that. Both males and females have an excessive male hormone, which is the testosterone, and that can affect puberty and growth. Children can they can get pubic hair at an early age. Symptoms of the non-classic. There's not a lot of symptoms when the baby's first born. This type cannot be seen with just simple blood tests because all their levels can be normal for the first few years of life, so it's not detected instantly. When they get older and they can present with more symptoms, that's kind of when they'll get tested. So they can have a cortisol deficiency. In females, they can have irregular or absent menstrual cycles. They can have masculine characters such as facial hair and excessive body hair, a deeper voice, and severe acne. And that's kind of with the overload of the male hormone testosterone. Males and females can both have early appearance in pubic hair and rapid growth in childhood, advanced bone age, and then as they grow super quick, they kind of mellow out and they're kind of a shorter shorter adults. So yeah, it has all to do with your hormones, growth. A little bit of information on CAH. A lot of this was found in the gen bank that we used for one of our projects. The mode of inheritance is autosomal recessive manner, so that is a recessive condition. Type of disorder, endocrine. The gene symbol is CYP21A2, and the gene responsible for the disorder is cytochrome P450, family 21, subfamily A, member 2. And the amino acid length of the protein is 495 AA. The function of the normal protein, which again, this information is from the gen bank. This is a monooxygenases. This gene synthesizes cholesterol, steroids, including cortisol and aldosterone, lipids. The gene encodes the enzyme steroid 21 hydroxylase. These are some Punnett squares that I made during one of our assignments for the genotypes. So the first one on the left is both parents are afflicted with CAH, and because CAH is a recessive disorder, you'll see that the letters are lowercase for recessive. They'll be uppercase if it's dominant. So lowercase means they are afflicted. So both parents, this is 100% right here, that the child will be afflicted as well. On the right, one parent is afflicted and the other does not have the disorder, is not considered a carrier. So that means that the parent that has the disorder has 2 of the lowercase, and the parent that is not afflicted and is not a carrier, that's both uppercase. So all this is comes out to be all the children will be carriers for the disease. This one again on the left, one parent is afflicted and the other parent is considered a carrier. So that means the parent with the disease is both lowercase. The parent with the which is considered a carrier has 1 uppercase and 1 lowercase. So with this, big A, little a, little a, little a, big A, little a, little a, little a. So this is a 50-50 chance that the children or child will have the disorder, and 50% that the child will be a carrier. Over here, this is neither of the parents are afflicted and neither one of them are considered a carrier, so that means both parents are uppercase A, so this is a 100% chance that the child will not have the condition. This is a congenital adrenal hyperplasia pedigree that I made during one of our assignments as well. You'll see that with a person with a little bit of red, they are afflicted with the condition. So you can see this is pretty large pedigree. 2 sets of parents. One has it. One is a carrier, and over here one does not have it, and one is a carrier as well. And so I thought this was a fun assignment. It was a good visual as well, and it really helped me understand what happens from generation to generation with a recessive disorder. The options for genetic testing, you can do prenatal testing, which can be done with an amniocentesis or a chorionic villus sampling, which is known as a CVS. The amniocentesis can be done in the first trimester. That is when amniotic fluid is extracted and the fetal cells are tested. The CVS can be done around 11 to 14 weeks. That is when a piece of the placenta is removed for testing, and that can be done vaginally or abdominally. Just depends on the approach. There are risks with that. Infection can be one. Early labor can be another one. And this can be dangerous for the baby. They can become injured during the testing, or they can die, which, is rare, but it happens. And so I think those are big things to consider when trying to decide if you want to do the prenatal testing. Newborn screenings can also be done. That is when the baby's heel is pricked in the first few days of their life, and it tests for multiple diseases. The blood test, it checks for the genetic mutation, which is the enzyme 21 hydroxylase. These tests are not mandatory, however, they're very encouraged. With the classic form of CAH, early detection is really important. Someone who decides not to have the testing can take their baby home. Their baby can get very sick. They can deteriorate really fast. They can even die at home, which is really scary. So if the baby is tested right when they're born, tested for the mutation and the different levels of hormones and in the blood and everything, the baby can live a pretty normal, healthy life with medications, surgeries, just to form a treatment plan. And this is my reference slide. Thanks for watching.